UVM and Dartmouth Cancer Centers are launching a partnership with the state's Cancer Coalition.
And the goal is to increase lung cancer screenings across the state. NBC5's Sid Bulay is live in Burlington for us. And Sid, you have more on the local partnership this morning.
Sarah Beth Zuri, I learned that lung cancer is the leading cause of cancer deaths in Vermont and the United States. And that is exactly why the two hospitals are teaming up with a new community education program, hoping to reverse these staggering numbers. 330.
Stage 1 lung cancer, probably stage 1A.
The number of Vermonters expected to die from lung and bronchus cancer in 2022. 14.5%, the number of at-risk Vermonters who have chosen to get screened for lung cancer, a number far too low for doctors at the University of Vermont Medical Center.
So the problem with lung cancer is that it's not well known that there's a screening procedure.
The screening can worry some, but Dr. Beth Zigman says it is non-invasive and only takes 10 minutes.
What happens is patients become symptomatic, and by the time they're symptomatic, they've already got advanced disease, so the disease has already spread to other organs like the brain, the bones, the adrenal glands, and at that stage, it's much less treatable, and the prognosis is very poor.
Dr. Zigman says if you do have lung cancer, early detection can save your life.
With early detection, we can detect cancers before they've spread, and those cancers are much more curable.
If you're over 50 and have smoked the equivalent of a pack of cigarettes a day for over 20 years, you're eligible for a screening, even if you haven't smoked within the last 15 years. And no matter what, you should be screened every year.
If a cancer is detected in a later stage when it's spread to other organs, the 5-year survival rate is about 6%, whereas if you detect it early, before it's spread, and it's still in one lung, the survival rate is 10 times that, so about 60%.
There are 7 locations in Vermont where you can get screened, and you can contact your UVM or primary care provider to help set up an appointment. Zigman says it's important to remember getting screened does not mean you'll have a positive test.
The vast majority of people who are screened have negative results. We want to find those people who have early cancers.
UVM and Dartmouth's educational program will have its first virtual community meeting on Monday, letting viewers know what to expect and how to sign up.
Again, that free virtual community meeting will be held from 12 to 1 and 6 to 7 this evening. If you can't make it, the hospital encourages you or a loved one to contact your primary care provider to look into getting a screening. Live in Burlington, Sid Bulay, NBC5 News.